Good morning and welcome once again to Daybreak Africa from our studio in Ondo State, the sunshine state of the nation. It's a beautiful morning. My name is Ikhonede.
And hi, I'm Afolashayo Hamzat. Welcome on the show today.
Good morning.
Morning.
Yeah, good morning. Alright, welcome back to the show. If you just joined us, it's still Daybreak Africa, and yes, it's time to go straight to our discussions for today. Like I told us before we went on the short break, I said we're going to be doing a bit of health and lifestyle today, and one of the very important things we'll be discussing today is PCOS, which happens to be a very trending issue in the health field in Nigeria today. And to discuss with us, actually, we have our guest from the United Kingdom who will be joining us online to discuss this very important issue. And I'm very sure that as our viewers out there, you will need to actually, if possible, on Daybreak Africa today, take your Bibles and your pen. You have a lot to learn actually, because it's highly needed. Joining us today actually from the United Kingdom is Ngozi Okoye. She is maternal and children nutrition consultant. So welcome to the show, Ms. Ngozi Okoye.
Thank you. Nice to be here.
I'm happy because what we are discussing today really has to do with women, and I'm a woman, and to discuss it with us is a woman, so I'm so happy today.
Everybody's cheating the man actually.
No, we are not cheating you, but then when it comes to woman talk, let's just give it to the woman.
Okay, straight to the woman.
So now I'll be the one to start because this deals with the woman. Talking about PCOS, it is so unfortunate that of recent, when you talk to a lady, she start talking about PCOS. You talk to another one, she start talking about PCOS. Then I'm so worried, like, what is going on? So let's just start with what exactly is PCOS.
Okay, so PCOS is the a short form for polycystic ovarian syndrome. It's a hormonal, or what we call an endocrine disorder. Unfortunately, it's usually termed reproductive disorder, but it's not. It's a hormonal disorder that affects women of reproductive age. So it's one of the most common endocrine disorders, and it involves assessing symptoms using the Rotterdam criteria. That's what we use to determine if a woman has PCOS. And why it seems like it's very common now is because a lot of awareness is being created around it. It's a genetic disorder. We don't have a known cause for now, but we see cases where girls have had it, and maybe their mom had it or someone in their family. And because in Nigeria we have poor family history updates, most people don't know their family history. A lot of things are swept under the carpet, and you have issues where girls that discover that their periods are irregular when they were teenagers, and they're being told to come back when they're ready to have children. So all these things combined together has made a lot of people not aware or found out ways to start fighting it or taking care of themselves better. And where you see people now, it's becoming more pronounced is when their fertility issues arise from it, like in the process of not being able to ovulate. And then you see women now finding out, oh, I have PCOS, and that's why it's now suddenly everywhere. But it's been there for a very long time. Just that new studies coming out, we have studies where people are now being conducted. Research studies are being done with women that have it to find out ways in which we can help them, and people are now being open. And also there's also shame that has to do with it as well. We know the kind of cultural society we live in, where people tend not to talk about even their menstrual health. Talk more if something is now wrong and it's dysregulated. People don't want to talk about it. But I'm really happy that there's a lot of uproar all of a sudden about it, and people really want to find out what it is, ways that you can manage it, and also start on time to manage it so that it doesn't escalate to something. And it affects the woman's entire well-being. It's not just about reproduction, it also affects her mental health as well.
Wow.
So that's about it.
Okay, I think I can pinpoint two things let me say something you can notice and feel like, okay, probably this is PCOS. You made mention of irregular menses, and you also made mention of not being able to ovulate. Is there any other symptoms whereby a woman can notice in her body and be like, probably this might be ovulation? Though most medical practitioners do say we shouldn't guess, we shouldn't do guesswork, we should just probably yes. But then what are other symptoms you see in a lady and you see, okay, probably this is PCOS?
Okay, so I mentioned something earlier that we use the criteria to determine if a woman has PCOS. It's called the Rotterdam criteria.
Okay.
And to meet the diagnostic criteria for PCOS, you must have at least 2 out of these 3. No ovulation or irregular periods that lead to no ovulation. Clinical or biochemical signs of hyperandrogenism, that's high testosterone levels, where a woman is producing excess amount of the female hormone. Polycystic ovaries or elevated AMH levels. I'm using this criteria because this is the updated criteria that was used in 2023, because every day we are learning new things. But the common features that people have experienced, because we have 4 different types of PCOS. Sorry, I don't want to go into so much science, but we have, phenotypically, we have 4 different types. So most of the time you see 2 women having different symptoms at the same time. So that's why we have a criteria. We always say if you meet 2 out of these, then it's determined that the person has PCOS. And note that it's a doctor that will give you your diagnosis, not just anybody. Not the radiologist, not the person conducting the ultrasound, but the gynecologist will give you the diagnosis. So irregular or absent periods, excess male hormone production, like I say. For some women, they have difficulty losing weight or gaining, or there's a weight gain, like incessant weight gain, and polycystic ovaries. I need to also activate that not everybody with polycystic ovaries has PCOS. That's the reason why the criteria must be used to exclude factors and include factors as well. And you have some women with acne, excessive facial hair. But that being said, the criteria must be used under the guidance of a doctor. Yes.
But then we have a situation in Nigeria where many people don't even like to, go to the doctors actually because anything that has to do with health issues today now, even with the advent of AI, people are always going to the AIs, Google, searching for what is actually happening to them. Then we have a kind of culture in Africa, not just Nigeria actually, in Africa, where many times when you are experiencing any health issue, you seek advice from people around you, the experience, the age old, and all that. And before we know what's happening, it's now we are seeing the situation here where the minute you're talking about these symptoms, I'm already imagining things, because I know some people who at least have 2 of these things you talked about now, and they don't even know that this is happening. How do we correlate this? Because I think this is more serious than thought about. Now, what's your suggestion to people who really don't love going to see doctors or seeking medical help, especially attached to things like PCOS? What do you think can be done to them?
First and foremost, I think those people have to really look at it from a way of restructuring their mind. If you know how serious it is to have PCOS, then you want to put your health at the forefront. Let me also reiterate that it's beyond just irregular periods. Women with PCOS are at risk of developing type 2 diabetes in the future. Women with PCOS need to check their cholesterol levels, and they're also at risk of developing cardiovascular disease. So when you see all these things on the table, I feel like you should be able to tell yourself the truth and look for ways to start managing your symptoms before it escalates to something that is beyond your control. And it's not just about, that's why I always hammer, is beyond fertility. For a woman to have a regular menstrual cycle every month, it's beyond just trying to get pregnant. It's about your whole being, your mental wellness. Your hormones, a woman's hormones is more than that of a man. It's not the same. Our system are more complex than that of a man's system. I'm not trying to in any way draw scores. No, I'm just trying to pinpoint the severity of everything. PCOS it's something that affects a woman's entire being. So it doesn't affect the entire being. You don't know how it's going to present in you aside from the common symptoms that we know with irregular periods, tillage resistance, or PCOS. It affects your mental well-being. Have you seen women who have PCOS that have excessive hair growth? Wouldn't you want to do something about that? Wouldn't you want to have this under control so that the symptoms that continuously show up will at least is managed? Please, if you love yourself so much, you would want to take care of yourself. And the first step to taking care of yourself is doing all you can to get the help that you need and you deserve. That is what I always tell anybody that I meet who is always afraid to go to the hospital for a diagnosis and for a treatment plan. You are taking care of yourself. You are also trying to stand up for yourself. It's a way of you standing up for yourself. And I believe that if you're standing up for yourself, you do all it takes to make sure that you are the best version of you.
Now, talking about PCOS still, is there a stage, because we were talking about it the other time, that it has different stages of PCOS? Where will he get to when even you as a medical practitioner will become scared for the person involved?
No, I didn't say stages. I just said different. Like everybody expresses it differently. That's why we have 4 different phenotypes.
Okay.
Do you understand?
Okay.
But where I'll be scared for somebody that has PCOS who are themselves or not attended to is when you start developing issues, complications as a result of PCOS, high cholesterol level that can possibly also lead to high blood pressure, type 2 diabetes, that can put you at risk of kidney issues if you do not attend to it. Are you seeing where I'm going to with this? Yeah, it's not just about not being able to have a child. It's about putting yourself at the forefront of taking care of yourself. So we don't want a woman who has PCOS to get to that end stage where she's developing a lot of complications, non-communicable diseases as a result of not following the proper treatment plan to help with her management of her symptoms. We don't want her to be neglected.
Okay, so as a lady, is it possible to prevent PCOS as a lady? Like probably there is a laid down rule or guideline a woman should follow so as to avoid PCOS.
Well, I'll be very honest, it's something that is genetic, and for something that the cause is unknown.
I'm even scared about this way. I say that the cause is unknown because I want to even ask Seth that from the
will that not be able to will you be
that has
treatable?
been done so far, have there not been any place where suspiciously
probably this is what caused this.
Allegedly these are the things that at least causes this thing, at least for now, pending further research. Have there not been anything attributed to the cause yet till now?
For now, the studies that are showing that has been implicated with regards to the development of PCOS, apart from genetic factors like family history of it, if you have a mom or somebody within your family that has shown symptoms of PCOS in the past, then you are able to start heads on when, like for example, if you're a mom, you experience PCOS, you have had to manage symptoms for the best part of your life. If you now had a daughter, when your daughter now comes of age and she starts seeing her period, she enters puberty, you want to do everything possible to help her have a regular period, teach her ways to manage her symptoms so that it doesn't exaggerate or get worse to the point of, she's ovulating or she develops complications like diabetes or high cholesterol as a result of poor management. So it's not something that can be cured as well, but it can be managed. And when you manage something, you're putting symptoms at the barest, like below par. It's just like somebody that is managing type 2 diabetes. You'll be able to help them to an extent that their blood sugar levels are regulated and they're able to carry on and have a good quality of life. So I can't say that with the recent studies there's no way to prevent it, especially for people who already have family history of it. but it can be managed. You can prevent that person from exhibiting the symptoms causes you to have irregular periods, insulin resistance, as the case with some people. Thankfully, research is coming up on having a good diet, good fiber, eating whole foods, protein, healthy fats, things that will support hormone, exercise as well. Exercise has shown to help with insulin resistance, and also strength training, sunlight. Recent research has even found out that women who have PCOS and also deficient in vitamin D, supplementation has also helped them to manage their symptoms as well. So all these things are coming up new recently. Research is being published about it. I wish more will be done with people in Nigeria or women in Africa to be able to better understand how we expose ours in terms of gene and our environmental exposure as well.
Okay.
So I can't tell you for a fact that the cure. There is no cure, but the management can help you put the symptoms to the barest minimum. It's all about knowledge. So as a mom who has PCOS and you're going to have a daughter, or you have a daughter that most likely or might pick up the genetic variants from you, you would want to do all you can to provide her with all the knowledge so that she might not have it. She may, you don't know. All these things comes up one day at a time. So, but you want to equip your child with the right way to eat, teaching her how her diet nutrition plays a huge impact on how to manage her symptoms. If she eventually has it, how exercise plays a huge role, vitamin D, light, sunlight, being happy, putting habits that will make you live longer above everything else.
Now, it is so unfortunate that even in this century, we have a lot of people that if they don't feel something, or if something is not off, they don't see a need of seeing a doctor or a medical practitioner. That's one. Number two, some people do not even know how to track their period to know if the period is irregular or not. Most people will be like, so far I'm not having sexual intercourse. If it comes, fine. If it does not, then I'm good to go. Then we have some people who does not even know when they are ovulating. They don't know what ovulation is. They just know, okay, I'm a woman, all because I look like a woman. What do you have to say to such people? Because I feel if you do not have irregular menses and your ovulation is there, or you don't even know if you're ovulating, then we can't know or guess or say probably I have PCOS.
Please, can you repeat the question again? Because
okay, the question now is, we have some people who do not know when they are ovulating. Some people cannot track their menses, all because they just have this thinking, this belief that so far they do not have sexual intercourse. If the period comes, fine. If it does not, fine. And since some of the symptoms of PCOS is irregular menses and no ovulation, how do we what do we say to people like this?
And this is why I strongly advocate for the importance of understanding your menstrual health. I am one that seriously advocate that your menstrual health is beyond whether you get pregnant or not, or you're sexually active. It plays an integral role in how you are as a person, as a woman. It's part of you. After your reproductive age years falls between 14 to 49, though now some people tend to see their period before 14. But that said, women need to realize that their menstrual health is beyond just procreation. It's beyond that. Having a healthy ovulation means that you have proper metabolism is set in place, your hormones are functioning properly, they're released at the time they're supposed to be released for you to have a healthy menstrual cycle. And then second, for women who take irregular periods, that's why we always advise that PCOS is beyond, like I said something about the Rotterdam criteria. If you have 2 out of the 3, it's not just about irregular periods. There are some people that see periods regularly, but they have polycystic ovary or they have hyperandrogenism. The signs will be there. You will notice it. You will. That's why you need to pay attention to your body. You need to understand your body. It's not just about when your period is or not. You need to understand your body. noticing things in your body that were not there before. Excessive hair growth when you usually don't use it, where it's not there normally, acne, hormonal acne coming up. Some people start losing hair. There are people, it's not about growing hair, especially. There's also hair thinning as well.
Wow.
There's that part. Yes, it's not just about growing excessive hair thinning. There's also what we call dermatitis. Some people start to have skin tags. There's people that their necks get so darker and their armpits when you're not pregnant. All those little signs are there, and that's why you need to pay attention to your body. Your person as a woman, you need to. And I wish in Nigeria that we'll move from waiting for things to get bad, but being proactive. We should be in a state of preventive care. Important to maintain a healthy weight. If you start seeing yourself gaining weight on it, like when you know if you check it, you are not really eating that much, but just gaining weight. You need to check it. You need to find out. It might not even be PCOS. There's also thyroid issues as well. That's why we use the Rotterdam criteria, and a doctor will exclude certain things because there are other things too that can mask themselves as PCOS. It might not be PCOS. It's antenna hyperplasia, discussion syndrome, excessive cortisol buildup. There are other things that there's even tumor. There are other things that could also present themselves as PCOS. So that's where your doctor comes in. It is to help you. So exclude those criteria out. There's also high prolactin levels too that can also affect women. See some women bringing out milk. You're not lactating. You're bringing out milk from your breast.
You're not breastfeeding. You do not even have a child.
So this is why I always advocate that women need to pay attention to their body. It's not just about when your period comes or not. Your period is very, very important, yes, but we also need to pay attention to your body. And unfortunately, we live in states where people are so obsessed with looking a certain way. People are not eating right. People are indulging in fat diets, 1 meal a day. It can affect their periods. You see somebody, because they are not eating well, their period does disappear. That is not a good thing. It's not. So you should. The kind of ways we eat also plays a huge role. Your maintaining a healthy weight will also help you, even though the criteria wants to remove the weight bias, because you know how people tend to be very sensitive about their weight. And to be honest, I really understand why it is there, but you need to take care of yourself, and loving yourself first and foremost will help you take care of yourself better. I always say that if you don't love yourself, you won't be able to take care of yourself. And the way you take care of yourself is putting your health first at the forefront, not waiting for something to get bad. Just taking note of things that are not going the way they usually do, and then going to a doctor to help you with it.
Yeah. I was expecting you to mention something based on the fact that I had a discussion with a friend who actually had PCOS, who was diagnosed of PCOS, and this will bring me to the aspect of therapy. When I spoke with this friend of mine, she was talking about excessive bleeding during menstruation, and she was like, the way she was talking, at the end of the day, it's as if it is reducing her self-esteem. It's as if she's now having low self-esteem, and I'm like, I don't know what to do because I'm not a medical practitioner. To some extent, she was like, she's even tired of seeing a doctor because there was one would tell her there is no cure for this, there is no cure for that. And she made mention of something that the last doctor she met, the doctor told her that the solution for now is when she gives birth. So it is somehow, truly, is it that the solution to PCOS is when the woman gives birth, or do you recommend therapy to people like who seem to now have low self-esteem?
I think before we answer, please, let's just take it to GoStat.
Okay.
We'll just go on a short break. After this break, we'll come back and we'll just get an answer to this particular question. Please stay with us. We'll be right back.
Welcome back. If you're just joining us, this is Daybreak Africa on KAFTAN Television, and that was GoStat. Stop procrastinating and start that business today. The question I asked earlier before we went on the short break was about you recommending therapy. Will you recommend therapy? And talking about giving birth is the solution to PCOS. How true is this?
First and foremost, the aspect of therapy. Remember what I said when I started in diagnosing PCOS, it affects the mental health. It's not just about the physical, but about the regular and all that. It affects your mental health. So yes, therapy is very, very important because it makes you feel depressed with the different expressions that the woman could be experiencing from PCOS, either in terms of acne, irregular or no period at all, or excessive hair growth, or losing her hair, or weight gain as well. So therapy is important. And then the aspect of saying waiting to give birth, that is what I'm fighting against. A woman with of the reproductive age, most times you find that a lot of women who are experiencing this at their teenage years are told to wait to come back. No, pregnancy is not the cure for PCOS. It's not the way to solve PCOS. Remember, in order to even get pregnant, you have to get your period.
And ovulate.
How do you do that? If you do not find a need or have a treatment plan to manage your symptoms, you do that. In fact, women who are pregnant and who have PCOS are termed high risk. Their pregnancies are termed high risk because they can develop a gestational diabetes if they are not monitored properly by their doctors or clinical nutritionists and dietitians. So it goes just that it's no longer called a reproductive issue. It is an endocrine issue. So it's not just about having children. It's about taking care of the woman, because what happens when she has that child? What happens when it's depressed? She's also prone to postpartum depression as well. What happens to that? So having a baby is not the solution. But putting a plan from the onset when you start noticing her symptoms to help her manage them and keeping it at the barest minimum, it should be the plan, not just the child. It's just having. It's just why I always say, don't give the woman contraceptive, manage her symptoms, like pouring water into a basket, because you are not putting a band-aid on something.
I didn't get that.
You wanted to say something? Sorry.
No, I didn't get the last thing you said.
I said that, and that's why some women are being recommended contraceptives to take to manage their symptoms. And I belong to the school of thought that contraceptives don't solve the issues. They only just slap a band-aid, like when you have a leaking tap and then you just use something to hold it while the tap is still leaking. What is going to explode? It does not attack the issues from the root cause. What is driving the PCOS? What is driving it? It doesn't solve the issues. So I believe in having a proper treatment plan and having people in your corner to help you, guide you through it. And that's the reason why we keep raising awareness about it, because obviously a lot of people do not even understand what it does and what it means to have PCOS. And even some women who are very lost because they don't have the proper support, community, and the right people in their corner to guide them on how to manage their symptoms.
Okay, let me ask a question. What's a proper treatment plan from your own perspective, from your school of thought? What's a proper treatment plan for PCOS?
Okay, the first thing is getting your diagnosis, and that's where the doctor comes in. And not just your gynecologist, you need an endocrinologist as well. An endocrinologist is someone that has a specialty in hormones. So you have that person there to be able to help you to remove other criteria that could mask as PCOS. When they eliminate that and they find out what the root cause your symptoms are all about, then your treatment plan will include a dietary management, supplementation where necessary. Okay. And for people who are having issues with their mental health, of course, if you you can also recommend that you see a psychologist about that, a psychiatrist, about that. Diet plays a huge role because your diet will help you to manage your symptoms in terms of how you eat, and that's where a clinical nutritionist or a dietitian comes into play. And then if the person has skin conditions, a dermatologist will also have to come in to place.
So it also has something to do with skin conditions too.
some people with PCOS tend to have skin issues like serious hormonal acne.
Oh,
Yes.
okay, acne, yeah.
Now, the thing I want to ask, because a lot of people have issues when it comes to the doctors that attend to them. You were talking about gynecologist, you were still talking about someone else.
Endocrinologist. Yeah.
Someone like me who knows nothing about it. Is it that I'll get to the hospital and be like, this is who I want to see, or this is who I want to see? Because to me, I feel when it comes to PCOS, do you even think medical practitioners, especially in Nigeria, needs more research, needs more reorientation when it comes to PCOS?
I will not lie. I'll be very, very informed on this issue, who have dedicated their time to work with women that are experiencing PCOS. But that being said, that doesn't mean I've not met some healthcare professionals who are like novice in this, or just give you a drug to just stabilize your blood sugar, but they don't go in further to find out the root cause of what could be driving your symptoms. So like for me personally, what I do with any woman I work with, we have a plan. I help you advocate for yourself, because when you advocate for yourself and stand your ground, that's when you can get the help you need. And then we also point them to people who can actually help them. Endocrinologists, thankfully things can be done virtually these days, so we usually recommend our clients to endocrinologists who can help them and then set them on the path on if they need drugs to help in addition to their diet plan. And then they also have to make lifestyle choices, like changes like their exercise, strength training, reduce cardio, try to manage sleep patterns, manage stress levels as well. So all these things encompasses how a treatment plan is organized, and that's where I am very strong in advocating for that, because I know how it feels like to go to the doctor and you're just slapped with one drug to just take and go back home, when you don't even have an idea on how to eat or what to eat, how to plate your food properly to help you to manage your symptoms, find supplementation that you need, not just what you see online. Everybody on TikTok or on Instagram seems to be talking about different supplements, but is it tailored to you, your own specific symptoms? And that's where personalized treatment plans come. So we work with women to help them to get the help they need, to make sure that their plan is tailored to them, personally to them, not just random. You get what I mean? So that's what we are working on, and I out of awareness that is being created on the social media space right now. A lot of doctors are becoming aware, and some of them are really finding it. They're working on equipping themselves with the knowledge they need to be able to support clients or patients that come to them with these issues.
Now, when we talk about noticing symptoms of PCOS, and let's take for example, I want to see a doctor probably because I have irregular menses or I'm not ovulating or something, and I am thinking of probably should I visit a general hospital or I go see a private hospital doctor, because some people will be like, you need to see a gynecologist. Why some people will be like, when you get to a private hospital, most of the time, some doctors be like, they can treat everything. You just go there, they'll be like, because they want to collect their money, they'll be like, I'm here, I can do this. If it is your eye, I'll treat it. If it is anything that has to do with your internal organs, we can treat it. And it's very rampant here. Very, very rampant. They will not tell you, oh, this is the specialist you're supposed to see and you as a medical practitioner, what advice will you give? Because I'm not saying we don't have some private hospitals who are really doing great job, but let me say 70%, even if it is not their line, they will be like, okay, I have an idea, and they will just be like, just take this thing, let me just collect our money and let her leave. So what advice will you give to a lady who wants to see a doctor, who has the time, who genuinely wants to see a doctor when it comes to PCOS?
I don't know how the system is now working in the general hospital, but I remember the last time I was there, you first have to see a general, just see a GP first, and then the GP will be the one to refer you to the gynecologist department. So it's a bit tedious and a long process, which can make someone tired. I will not lie, but even here, that's the standard procedure. You have to see your general practitioner first, and then they refer you to the gynecologist, and then that gynecologist, if she or he feels that this is beyond their own area of expertise, then they refer you to a specialist. That is usually the protocol. But in the process of this, they also tell you the tests you need to run. While they are gathering all the investigation reports, they are also referring you to the right person to attend to you and help you manage whatever symptoms that you are experiencing. That would have been that is talking from a general perspective, like you go to a general hospital. But if you do have the money to go to a private, I will insist that if you're going to a private hospital, apart from depending on the protocol existing in the hospital, of course they'll still say you should start with a gynecologist or a GP. Insist on seeing an endocrinologist. Insist on that.
Okay.
And endocrinologists will be able to tell you the tests you need to run to remove other other causes that could be masking themselves as PCOS, so that they can have it straight ahead, know what they are focusing on head on from the beginning, so that they can be able to help you curate that treatment plan that will be tailored to that person. It can be long. It can be very stressful. I will not lie to you, but it is the system we have right now, and we have to work with it. But just work with it. If you have money, I'll always say go to private, because I, like in Lagos, for example, in Lagos, I know some good wellness, like even some of my colleagues, I know where they work that have treatment plans and doctors are available, dietitians, clinical nutritionists are available. It's just your money that will speak for you.
Definitely. Which even brings me to this one, actually, because I feel treating this could be very expensive. That's just the whole thing. And,
obviously.
And I observed that a bulk of people too that will be affected by this I won't call them the less privileged. They might just be financially disadvantaged to actually attend to a problem like this. I don't know. I would have asked for local solutions to this.
Probably helps.
Probably helps. But then at the end of the day, looking at it, how can we help this is not even a matter of even the wealthy, because in Nigeria right now, we're having a situation where a lot right now, due to the current peculiarities of our economy, are not financially advantaged enough to, attend to things like this. I'm just asking, are there minor things they can do to actually ensure they can attend to this?
Well, in Nigeria right now, the one of the issues they are facing is the lack of a proper health insurance scheme to help people afford these things. But I'll not lie, some of these tests are not cheap. They are not cheap. So if there's a way it can even be subsidized, and then you can even help around. But even that being said, I know a lot of my colleagues are working around creating content. I create content online to give people an idea of what to do on their own while they wait for their diagnosis or wait to get the help that they need in terms of their diets, lifestyle changes, things you need to change to help you to manage your symptoms. And one issue that is really playing a huge role right now is the issue of stress. With the economic situation and the way things are, and the poor food systems where food that is actually good for you is more expensive than the ones that are terrible for it's crazy.
For PCOS.
So, but what I will always stand on is our foods are healthy, our foods are powerful, our foods are whole grains, like from the north to the south to the east to the west, our foods are good. So I always advocate to, even when we used to work in the communities, eat our own foods. Try to rest. I know it's not easy because everybody seems to be doing 2 or 3 jobs
at the same time,
or 4 jobs at the same time to make ends meet. But just try to find peace on things that will relax you, and eat our whole grains. I remember that time when we had issues with Naira issue when there was no money.
Yeah, when there was no cash here.
I watched something happened, and it really stopped me. I saw that people could not afford to go out to buy fruits because they didn't have cash, but it was easier to get a can of Coke and something junk than actually real food.
Because those ones could take transfers actually.
And, and that's where the issue still lies. The food systems. Our food systems are not structured to help us health-wise, and it's sad, but that's what it is. We need to go back to our roots. We need to go back to our own traditional made foods to help ourselves.
Wow.
We find out a lot of people are dependent on ultra-processed foods, junk. If you ask somebody, what did you eat today? You find out that maybe the person didn't even have any fruits or vegetable in there for that whole day, but they had a can of soft drink. They had one snack or the other, but they didn't really eat proper food because it's cheaper to get snack than to eat food.
So at this point, I'll be talking about government at this point, because let me say they are the Oga at the top, especially in Nigeria of today. What is it you think the government can do to help us, especially in our health system, as a medical practitioner?
Number one, we need to find ways to subsidize our health services so that people can be able to afford them. Not everybody can go to a private hospital.
Definitely.
To do this. They can't. We have people at the primary level, at the grassroots levels, the primary health care centers, and some of them are so horrible. There was one that Proko Doctor showed the other day. If you need to see where women are meant to go and give birth, it was a horrible eyesore. We need to start from the primary health care levels to equip the staff, pay them better. If you don't pay people better, they will not be encouraged to work.
True. That's
just the truth. They will not be encouraged to work. Secondly, doctors, the government needs to improve the aspect of employing nutritionists and dietitians in these healthcare issues, because you find out that a lot of people don't even know that there is actually nutritionists or dietitians. They don't know. Everybody feels they understand food, but it's not as simple as they think it is. It's not. And you find out that people say, oh, I don't know who a nutritionist is, I don't know who is a dietitian. I'm talking about people in the grassroots levels, and it's sad, but it's what it is. So we need to advocate that systems are created where these people are placed in this place, and they're also paid well too for their services. The fact is, at this stage in Nigeria, where they're still having a lot of medical professionals going on strike because they are not being paid well, or you have a lot of them leaving the country because they feel like they are, what's the word now?
They have more opportunities over there. Are more celebrated there.
Yeah. Yes. So you find people are overworked. You find out a doctor is doing the job of everybody, or a nurse is doing the job of everybody. People are not even working around their scope of practice because the system is heavily burdened. So the government needs to really focus on pumping more money into the healthcare sector, because it's only a healthy generation that will increase proper labor force. If you don't have a good labor force, we won't have a country that is producing anything. China is the way it is today because they spent a lot on their healthcare system in order to make sure that their labor force lives long. Japan is where it is because they have one of the longest lifespan in the world.
Very true.
You have living long, and because they spent a lot of money in their healthcare system. And I'm proud of where the world is going today, because people are going to really develop a lot of healthcare issues in the future. We have young with high blood pressure right now. It's sad. Let's talk about kidney issues right now. So,
you know, you are the first dietitian actually, or nutritionist. Let me not say dietitian, because nutritionist that is going to tell me to my face that our local foods are very, very healthy and great. The last ones I knew actually told me that the processed ones are better. But let me just ask you this majorly, even as we round off totally on this discussion, healthy living, especially for ladies, food-wise, what do you suggest at this particular time, at least for now, so that at least if they can feed well, at least maybe some of these symptoms can be reduced, and at least their road towards successful living, healthy living, and cure, I won't say cure, managing things like PCOS and other diseases you talked about can be, you know, assured to a very large extent.
Yes, I would advocate eat whole foods, whole grains, your ofada rice, your yam, sweet potatoes. They are good for us. We have millet, we have sorghum, we have a lot of good foods around us. We have foods that gari, we have probiotics, we have our ubaka, uba,
Gari
we
is
have
good.
uru, we have yogurt, we have fura de nono. All these things are healthy. We have fruits and vegetables. A lot of people don't eat fruits and vegetables. They're supposed to have at least 5 servings of fruits and vegetables every day. Take advantage of fruits and vegetables that are in season. Right now, we have mango in season.
Yeah, true.
We have
Watermelon.
take advantage of. We have watermelon. We have pawpaw.
Apple.
Take advantage of that. We have apple. We have ugu. We have bitter leaf. Take
Yes.
advantage. Just make sure that you're in everything you're doing everything to support your weight and also physical activity. People don't walk anymore. People don't take walks. People don't exercise. You mustn't go to the gym in order for you to be active. You can just keep sitting up at home and sleep. It can do you so much good. Take advantage of the sun early hours in the morning or late in the evenings when the sun is not so hot. Get some vitamin D. Eat our fish from mackerel fish, your protein, eat your omega-3 and your vitamin D. Take your milk.
Wow.
I just want to say our foods are
All
healthy.
these things you
The only
said
thing I'll
actually,
say,
the problem I have is just that there are some
putting
people
oil.
that think that
Yeah.
if you are taking those things, you are from the poor. If you trek now, they will say you are poor. If you eat gari or all these things, they will say you are poor, that you are not wealthy, that you have to take this, you have to take that. There's this competition.
I don't understand why you're so particular
We have
about
a
gari.
serious classism issue in Nigeria. I eat abacha. I eat beans. We have so much legumes in Nigeria that people don't even know of, apart from the beans that we know of.
Wow.
We have pigeon pea, we have African yam beans, we have other legumes, we have finger millets. People ignore all these things. They are there in the market, but we are just ignoring it. We want to go and eat something and make you look like you're foreign. Take advantage of our own. Okay, there was a recent study that published that, now that they see that our African cassava and plantain is actually healthy. It was published by a foreign journal right now. I saw it last week. And I was like, oh wow, now they're saying our foods are healthy. But before it wasn't. But it is. The only issue I have is the way sometimes with the onset of certain diseases now that are coming up and with the lifestyle that has changed. We are not farmers right now like our forefathers. So a lot of things has changed in terms of movement and stress levels. So I will not advise that you soak your food in oil in this life. No. Everything should be done in moderation. Eat our soup. Our local dishes are so nice. Egusi soup, me and taushe, me and kuka. All those foods are good. So why are you neglecting it to come and eat something that you don't know?
Oh my goodness.
Thank you for taking this table.
Something you want to read so you can form.
Thank you for taking the table.
Now I want to ask concerning water. Because you see, there are a lot of people that will be like, you need to take water, and I've heard a whole lot of medical practitioners be like, water is life. You need to take water. They will even say, even when you're not thirsty, take as much water as you can take. So concerning PCOS, is there in any way where water helps?
Yes, water does. Water keeps you hydrated, of course. The last thing you want to do is to be dehydrated. Water helps to support your hormonal balance. Proper hydration helps your liver and your kidneys to eliminate excess hormones, including the estrogen and androgens that I talked about. You understand? It also helps your dependence to reduce your dependence on sweetened drinks. If you drink a lot of water, it will really help to reduce your dependence. And not just water, taking water fruits that are rich in water as well, like watermelon, oranges. They also help. So water plays a good role in helping to improve insulin sensitivity as well. So it also helps as well.
Okay.
It also helps with water retention. That's what people do. It helps with constipation. So people battle constipation. So water is important. I will never ever neglect the fact that water is important. It is.
Okay, I think the final thing I'll be asking now is the general advice you have for women out there that has PCOS.
You're not alone. It's not a sentence that means that you will not have children. There is help. There is help. You just have to find the right person to help you through it, and you can manage it. You can actually get a good period. You can manage your symptoms, and it doesn't mean that you're designated to suffer for the rest of your life. No, with the proper treatment plan and management protocol, you will be fine. And also having a community, there's a community out there for you, so don't be ashamed. There are people actually here to listen to you. So if you want to rant, you're not alone. Don't feel like an outcast, that you're the only person that is going through this. No, you're not. Some people might not want to talk about it, but there are also people who are also talking about it. So don't be ashamed of it. And I'll still state again, it's not an infertility sentence. There are people with PCOS I have worked with who have gone on to have children. Marriage is an example. Stephanie Coker is an example. They had PCOS, but they have had children. So it's not an infertility sentence, and it doesn't mean that you should be shunned. It doesn't mean that you're disabled. You're not disabled. You're even a stronger person. You have superpowers. With PCOS, it means you can build muscle better than the average lean girl that is struggling. And muscles help you with insulin resistance. Muscle is your superpower. So don't let anybody make you feel less than who you are. You are not less. You are powerful. You're strong, and you're the best as well.
Thanks so much for
this
segment.
Much.
Really appreciate this discussion with you. And yes, thanks for. I learned a lot actually, because
I did too.
I have a wife and I have a child, so and she's a daughter too.
I'm a woman and I have a lot of women around me.
So definitely, I can tell them something when I get out there. Like she said rightly, don't feel you are alone. There's a community for this. I even like the fact that in our generation today, there are communities for everything.
Yes.
So don't feel you are alone. At least there are people with you in this particular fight. And like she rightly said, you are not alone actually. Thanks so much, Dr. Ngozi Okoye, for this.
It's a pleasure.
It's a pleasure. And this is where we go for sports. This is where we go for sports. After sports, we will be coming back here to say our conclusions on Daybreak Africa. So please stay with us. We'll be right back. Welcome back to the show. If you just joined us, it's still Daybreak Africa, and yes, it's time to say our goodbyes. I hope you enjoyed sport actually as much as I did.
I really did. I did enjoy it because there's been a whole lot of things I've heard about PCOS, people around me saying different kind of things, their experience and whole. But you know, one of the things that actually caught my attention from what our guest said was, ladies with PCOS, women with PCOS should not see it as a death sentence.
Yeah, they shouldn't.
And we should also eat healthy. Don't form. Don't say because I want them to know I can eat shawarma, I want them to know I'm a big girl, I can take pizza. Think about it. I am not saying these things are bad, but then health-wise, is it doing you any good? Bikonu, eat ofada rice because our guest made mention of that. Eat good food, unprocessed food, eat vegetables, eat fruits, take a whole lot of water, and try as much as possible to rest. And also, ladies, we really need to do so well when it comes to our hygiene.
Our hygiene, yeah.
This is number one, and it should be our priority.
I think one of the best things she said to me today was the fact that Gary is
Gary. I know you are going to mention that, Joshua. Because Joshua, wait, what is it with you and Gary? The moment you mentioned Gary, you repeated it.
No,
like,
I'm joyful because
why?
I told someone something recently that this thing saved me all through school, and it has been saving.
But Joshua, calm down. Take it easy on Gary.
No, I take it easy on Gary. I don't drink Gary much actually. This year I can count how many times I drank Gary, but then I might even go back to it soon. In the honest truth, but one of the things I just on the very serious note now, that's on the lighter mood. But on the very serious note, I think one of the things she said which really thrilled me was, and it agreed with a philosophy I had some years ago. When we are not that wealthy, we are all living healthy.
Yeah.
When we are all not wealthy, when we are not wealthy, we are eating good vegetables, we are eating fresh fruits and all that. Because that was what we could afford, and our local foods. The minute you got money, you began to
explore
everything processed.
Different kind of food. You don't even know how it is made. You don't know what it is made of.
Many of us never knew what they call
all this soda and all.
Not even soda. Soda is even okay. None of us know what they call azul and all those things before.
And we should ask people like you, men most especially.
Money came, we began to visit clubs and all that. We began to drink all those things. So we are living on LD while we are getting wealthy. the truth is, at the end of the day, you need to try as much as possible to live healthy. And like she said, PCOS is not the death sentence. There's a community for you. You can still survive this. So please, as much as possible,
don't die in silence.
Don't die in silence. Go out there. And don't be shamed. You can never shame the shameless.
Never.
Don't be ashamed of anything.
That should not reduce your self-esteem.
Everybody has health issues one way or the other.
Yes, so
one way or the other, we are all just managing one or two things. So definitely, you are not the only one in this. So please be confident enough to seek good medical attention. But then, that's all for now on Daybreak Africa. Till we meet tomorrow, my name still remains Ikhonede Joshua Yadeji.
And hi, I'm Afolashayo Hamzat. Bye for
guys.
now.